Hi, sorry, you've been waiting for a while. And so you've had some procedures done before, yeah? Can you let me know about them? I know they've already taken a case sheet, but you've told them that in 2013 you had a BSSO maybe?
Yeah, so I had a underbite, I think.
Okay.
And it was my lower jaw was moved forward.
Okay.
And then because my lower jaw was moved forward, my kind of chin was protruding out.
Too much, so they took the chin back.
So they took the chin back, and then I didn't like it, and they just took it back too far, and it just changed.
Yeah, and then they also did a genioplasty in 2022. Like a chin work.
Yes.
In 2022.
It was a reduction.
Okay.
Last year. Yeah. So I had the chin reduced.
This is what they have done here.
Yeah, and I'm really not happy. It's just, do you know what's happened? It's sort of like made my face look squishy. Like before, I had like more of a sort of squarey.
Why did you go for the genioplasty at all?
I felt like my chin was protruding out here.
And they've used some. They removed a lot of bone.
Yeah.
A lot of bone. Are you having any problem with your teeth? Because they've also put the implants very close to your tooth roots. Are you having sensations on the teeth? Nothing? No. You're feeling normal? No problems? Okay.
But for that procedure, I did go to Turkey, which is really rather stupid of me because it wasn't a maxillofacial consultant. So obviously, I don't think he kind of knew what he was doing properly, you know.
Okay, now see, now what's done is done. What we'll have to do is we'll have to definitely remove their implants or go around these implants and get the work done for you, right? That I can do. But what is it, how much of a chin? There's also asymmetry if you notice.
I'll show you some pictures of me before.
Yeah, sure.
I look very different. Okay, so can you see I sort of had more of a sort of, so I had a squarey sort of top with a sort of V kind of shape. That's how I was before. It was sort of like this kind of
So would you want to go as close to this
as possible?
Okay, you would want to do that.
Yes,
okay, cool.
as possible.
Okay, that's fine.
Do you see
All
what
right.
I mean?
Yeah, I know. We can do that. So what
will it help sort of here? Because I just feel like it's like that. Do you see what I mean? Is it going to help?
No. See, the lower third of the face, we can get it. I'll have to make a cut, maybe something like this between the existing root and everything, and alter the chin, make it come a little bit forward to get that.
Yeah, I don't know if you can see.
Yeah.
You can sort of see
This was a very nice picture.
Yeah, very different. It's very sad.
There wasn't a need for genioplasty actually for you.
There wasn't.
I know your chin is a little bit strong, but you're tall, and so that chin is fine.
I think it was like just having the difference.
And your face is also quite long, so a big, strong chin actually suits you.
Yeah, but my face was kind of more sort of like
broad also.
Squarey as well, like this. It was kind of filled out more here.
But
see, so
but you don't want that now, right? You only want me to get the chin a little bit forward to this pointy thing.
Can I just show you in the mirror?
Yeah, you can.
So I would like just a slight sort of. So how my face was before, it's sort of like it's kind of gone in like that. So it was more slight, just a slight sort of squarey. It was. Does that make sense? It's hard for me to sort of explain. Slightly squarey, and then.
But now, when we are going to do the procedure, so you would want me to see. There's a little asymmetry there. This side is sticking out more, but you want me to get the chin a little bit forwards.
A little bit, yeah. I'll be happy with that. Whatever you can do to make me look like the way I did in the
Okay,
photos.
fine. That I can do. We can do that. So when we do that, this also is going to get reduced. This is also formed because they've done the reduction. So there's some extra soft tissue that's happened there. Yeah, we could do that.
And
We also get rid of this asymmetry. So we take it in, get a little forward.
yeah.
All right. We can do that.
Yeah.
Okay, so and you also asked or something for some augmentation there.
Well, yeah, just so, but as you can see in the pictures, it's kind of like my face it wasn't so, I don't know, it was more like,
You want me to broaden it?
Slightly broader it was. I don't know if he's shaved here.
He has, they have.
So it was slightly broader here, just ever so slightly. Yeah, just to sort of, had like a bit of
But I think that's maybe
shape.
not needed. You want me to put a foreign material inside? Not a good idea, I think.
You don't think so? I just want to look how I used to look. Little.
I think we can see when we do a genioplasty, we can get a good improvement in this part of your lower jaw. But this part is going to remain the same. It's not going to change. If you want me to change there, I have to either use a foreign material or I have to do another osteotomy. I don't recommend another osteotomy for you because you've already had an osteotomy, you already had a reduction, and we're planning a third osteotomy now. So it doesn't make sense to keep going back and forth and cutting this bone and moving it around. It's not a good idea, and it's not looking too bad. You're already beautiful, you're not like bad looking by any chance. So we shouldn't do unnecessary things. Is I don't think you should do. Unless you're crazy, like I just want it done types, then we can look at some augmentation with PEEK. PEEK, what happens? It's simple. We place a foreign material inside and I fix it with one screw. It's simple for me to do it, but it can cause problems years later. Now, the good thing is you've had a BSSO, you've had another surgery 10 years later, but you see everything is healed. There's no problem. It's part of your own lower jaw. That's stable and stable for life. When you use a foreign material, unfortunately, that's not the case. I do have patients who, after a decade, sometimes even later, that can cause some problems. And then you might have to revisit it. You might have to clean up. You might have to sometimes even remove it off. There's a small chance of that with this foreign material.
Yeah. And when you say that, what kinds of, so you mean as in like an allergic reaction or?
Not exactly allergic reaction, no infection. What happens? So it never actually heals with your bone. It always stays there as an added material but heals. So let's say a few years down the line, someone bumps against that part, it can move. And then once it moves, then it can cause problem again.
Right.
But with the jaw, it's not like that. It becomes your jaw. Even if I cut it and put it in another place, just like how the two earlier procedures is now healed and become part of your jaw, the same will happen again. And because you've had a couple of procedures, and now this is your third one.
I know, but I just want it all done. I can't explain it. I just feel like it will look better.
A little bit of a size.
A little
Okay.
bit. Just a little bit.
Okay. Then we'll have to go for this foreign material.
I just want it done. I just want
Not the.
I don't know, because it bugs you a lot, but the advice is not to.
No, it's a poison.
What's she saying?
No, she's saying if the advice is not to, you would, like, you know, but it's like.
I just think it's a overkill. It's another procedure. Why would you want to get it done? See, here there is a genuine issue because the chin has got squished. They've really cut the chin too much, so we can augment it.
Yeah, I think the issue is.
And that looseness will get better. Here, whatever is loose, this will get tighter with the genioplasty. But you want some on the sides?
I think so. Because he's cut it here.
Right. If that's your issue, then it's
See what I mean? I think because he's cut it here, and because of the way I looked before, I think a little.
A little bit.
It's like, what's the point?
just do it properly.
What's it going to be like?
If that's what's bugging you, that's
Little. Wow. When we talk it little, we mean like little, not
Like 4 or 5 mm.
What do you think?
Yeah, not more than that. And also, I think this side is slightly different from this side. It's not symmetrical.
Yes.
So this side probably needs more, and that side probably needs lesser.
Yeah, I agree. Yeah, because it's almost like this. It's almost like.
Yeah. So why don't we do one thing then? We'll only augment this right side and leave the left side alone. Are you happy with the left side?
I'm not happy with the left side.
Not happy with the left side.
I'm more unhappy with the left side.
You're more happy with the right side?
Yeah, I feel like this side. It's just all sort of like collapsed a little bit too much, and this side is not as bad.
But your left side looks better than the right, because the right side there's no definition to the jaw.
Have a look. Sorry, I'll just explain what I mean. So, yeah, it's like here. I just feel like I feel like that side's worse. Yeah, but I think it's just subtle. Resettlement.
Okay. And what about this region?
This is fine.
Okay.
I'm not bothered about that. It's more like I had more of a like slightly, I would say like that. Just slightly, just there.
You want it to be broad right
just
here?
Slightly.
This
yeah,
side.
because that's how it was before.
Okay.
It was more of a sort of squarer sort of shape with a V rather than a round. Does that make sense?
Yeah.
Oh, it's so hard
So
to
that's
explain.
more of the body then. So this is the angle, this is the chin, this is the body. So if you see, there's a nice curvature, and this is being removed for you. It's been made straight. So you want that back, so you want me to add it here and nothing here. I get that right?
Yes.
So that's body. Yeah, so I'm going to do the body now. And then we're going to do the chin. So the chin is going to be made between this, and then we'll somehow correct that. It should be possible to make a kashara.
And what about this muscle? Is it going to sort of like...
No, it's not going to come down.
No,
it's going to be the
not
same
gonna
the
come
way
down
it is.
because okay.
It's not going to sag.
My chin actually used to be propped up a bit more.
Okay,
because there was
I see the pictures.
Bone, yeah, because there was bone.
So we're
underneath.
trying to go to that stage now.
Yes.
So it's going to get, if not so much, but we try to improve.
Okay.
Yeah. When?
2 days ago.
Saturday.
Was you at the airport? I feel like I saw you. Is that
I think it's Saturday. Not Saturday. I think it was on Friday.
I think I saw you at the airport. I said that to my niece.
No. But I was near the airport tomorrow. Yesterday.
Oh, okay. Sorry, just got sidetracked now. I thought,
Yeah.
Okay.
So when did you have?
it.
When did you have something to eat or drink today?
I haven't eaten at all.
Really?
No.
Since last night?
Because when I spoke with, I was told that I would have the surgery today. So because I work for surgeons, I am new to fast, if that makes sense. So I've just been fasting from this morning.
Awesome. Then we could do it earlier. Okay. So we could do it probably by. Every time क्या हुआ? Around